Skin signs of lupus. There are many celebrities at this point who have been very open about their struggles with lupus. Lupus is a chronic inflammatory condition that can affect the skin. And by raising awareness about this condition, a lot of people are searching for more information about lupus. So in today's video, as a dermatologist, I'm going to be explaining what lupus is, and I'm going to be going over the skin findings of lupus, what they look like, so that you can have a better understanding of this condition. Now, lupus is actually an umbrella term for several different conditions. Lupus in general is a chronic inflammatory condition that can affect pretty much any organ system in your body, like your liver, your kidneys, your brain, your heart, your lungs, and your skin. And when it involves your skin, we call that cutaneous lupus. Cutaneous lupus can show up in a variety of different ways. It can be a widespread scaly rash on your back. It can be the classic butterfly facial rash where you have redness overlying the cheeks and nose. Some people develop thick, round, scaly rashes on their face that lead to scarring. Cutaneous lupus can also lead to the development of painful sores in your mouth and your nose. It can affect the skin on your scalp, leading to scarring, permanent hair loss. Generally speaking, when people say lupus, they are referring to the most common type of lupus, which is systemic lupus erythematosus. This is the most common and the most concerning, the most severe, as it can impact pretty much any organ system in your body, like your liver, your kidneys, your lungs, your heart, your brain. Systemic lupus erythematosus, SLE, is an autoimmune disease. An autoimmune disease is one in which your immune system attacks your own body. It can be attacking your joints, your heart, your lungs. In the case of cutaneous lupus, it can attack your skin. But you can actually have lupus just in the skin. You can just have cutaneous lupus, not systemic lupus erythematosus, meaning it's not potentially impacting various other organ systems in your body. And there are a lot of types of cutaneous lupus that, for the most part, are just skin lupus. I'm going to share with you 4 different lupus rashes where the rashes are a clue that the lupus is pretty much just in the skin and for the most part remains a skin-only type of lupus. The number 1 most common type is called discoid lupus erythematosus. With this condition, you get these round disc-shaped rashes that happen on the face, the scalp. These tend to be very scaly, and sometimes they look as though they have very prominent pores, especially on your face. As these patches fade, they can leave behind dark marks. They can take away the skin color. This is especially the case in people who have deeper skin tones. Discoid lupus erythematosus will go on to scar, so it's really important to have it treated. If you're familiar with Seal, he had discoid lupus erythematosus throughout childhood, and so that is what the scars on his face represent, and he has been very open about this in the public. Discoid lupus also, again, can affect the scalp and lead to scarring, permanent hair loss in the areas where it is arising in the scalp. The second type of skin-only lupus is called tumid lupus. This is not very common. You get these firm, raised rashes, bumps, often on the chest, for whatever reason. In contrast to discoid lupus, these resolve with no sign they were ever there. They don't leave behind any hyperpigmentation, hypopigmentation, and importantly, they do not scar. The other type that remains a skin-only lupus is called chilblains. Chilblains, you get these itchy little red bumps on like the fingers, the toes. It can also happen on your ears, your elbows, your knees, and your nose when you are exposed to cold, damp conditions. It has this kind of dusky purple color. I actually already have a video all about this type of skin lupus, which I'm going to link down below in the description box. So if you deal with this or similar related conditions where you get little bumps on the hands when you are exposed to cold, damp climates, then you're going to want to check that video out. I'll link it down below. The 4th type that remains in the skin is called lupus profundus, or it also goes by the name lupus paniculitis. And this is lupus affecting really really deep parts of the skin, namely the fat. Paniculitis just means inflammation of the fat. So in this type of skin lupus, it's basically the lupus coming into the fat in the skin, and this leads to these painful nodules. As these deep-seated lumps heal up, they leave behind permanent hollows. So as you can imagine, treating this ASAP is key to prevent it from going on to heal this way, which can, as you can imagine, be quite debilitating and disfiguring. But as far as skin lupus that is more in keeping with, oh, this person might just have stuff going on internally, there are two main types. The first is called subacute cutaneous lupus erythematosus. This rash develops pretty quickly with sun exposure and consists of these round, ring-shaped, raised, red, flaky rashes. It can have a purplish appearance and deeper skin tones. They have a really scaly, flaky border, and honestly, a lot of times they can be misdiagnosed as psoriasis and even eczema, because they kind of can look, this rash can look similar to those other skin conditions. So that's subacute cutaneous lupus, and then there is acute cutaneous lupus. And acute cutaneous lupus is probably what actually most people are familiar with when they think about lupus, and that is that butterfly rash, otherwise known as a malar rash, where you have a reddish rash over the nose and cheeks, and it usually appears after being in the sun. Sun does elicit this, and it is a manifestation of systemic lupus erythematosus. It's actually one of the diagnostic criteria, and if you have the butterfly rash, it's really important that you see your healthcare provider, a dermatologist, a rheumatologist for further workup. Now, that being said, there are a lot of facial rashes that actually happen in this area and can look like the butterfly rash, but are not it. So whatever you do, don't try and self-diagnose yourself as having systemic lupus erythematosus. For example, rosacea can kind of look like a butterfly rash. Seborrheic dermatitis also can look like a butterfly rash. If you're not super familiar with the subtle differences between these, it's easy to confuse them. So just keep that in mind, that not every rash that happens in this area is a true lupus butterfly rash. Aside from the butterfly rash though, sometimes acute cutaneous lupus consists of an eruption of like red bumps like on the chest, the arms, even the legs. There are two other types of skin lupus that, just to confuse you even further, affect the skin, but we don't really consider them cutaneous lupus erythematosus proper, because they're a little bit more wiggly, if you will, in terms of how they go. The first is actually neonatal lupus. Yes, newborn babies can be born with lupus in the skin. It's called neonatal lupus. And when babies are born with neonatal lupus, it can present with a rash of round raised red rings on their face, on their upper chest, and their scalp. These round rings are scaly, but importantly, they will go away when the baby is maybe a few months, and they do not scar. The rash in the newborn does not need to be treated. However, the newborn does need to be followed carefully, because this type of neonatal lupus, as it's called, can affect some other organ systems, their liver, their blood counts, and their heart. It actually can cause a problem with conduction in the heart and a slowed heartbeat. And neonatal lupus is unique because it's caused by the mom actually passing lupus antibodies to the baby. So if you weren't familiar, when we are in our mother's womb, we don't make these important proteins called antibodies that help fight off infection, but we get some of them passively from our mother. So we are born with some of mom. She donates some to us. But if mom has antibodies that are autoimmune in nature, she can pass those to baby, and baby can have them for the first few months of life, causing things like, well, neonatal lupus. So that's how this happens. But as the baby grows up, those antibody levels drop, they wane, because the baby's not making them. They were just donated to the baby from mom. And so the baby is, the rash clears up, and you monitor the baby for some of these other organ system things. But it doesn't necessarily mean the baby is going to be negatively impacted. The other one that's kind of in this somewhat nebulous territory of not really full-blown cutaneous lupus, because it follows sort of, it goes to the beat of its own drum, so to speak, is drug-induced lupus. So there are a variety of medications that you might take can actually trigger a lupus-like illness. Drug-induced lupus can happen after taking a medication for months to years. The reason this isn't, really classified as a true lupus is that this will go away once that offending medication is stopped. Minocycline is an antibiotic that we prescribe in dermatology sometimes for different skin conditions, and actually it's one of the medications that can cause this potentially. And I've actually heard from some of you guys that you developed drug-induced lupus while you were on minocycline, so it certainly can happen. Drug-induced lupus from a medication can cause a skin rash, but for some people there's no rash and they just have like some joint pains, shortness of breath, discomfort with their chest, their heart, maybe a little bit of a fever, lupus symptoms. But then again, if it's recognized and the medication needs to be stopped, obviously, then those things go away. And that's that. So now that we've gone over all that, at this point in the video, hopefully you have an understanding of the fact that lupus is a chronic inflammatory condition that can present in many different ways. There are many different variants of it. And so one person's lupus is going to be very different from another person's lupus. So is there a cure for lupus? No. Short answer, no. There is no cure for lupus, unfortunately. Whether it be systemic lupus or lupus that is primarily in the skin. There is no true cure, but there are medications and treatments that control the disease. And that is really important because, as you can imagine, this can be pretty debilitating, life-threatening. I mean, it can affect your internal organs to the point where, as you've seen in the media, celebrities requiring organ transplants because of their lupus. Pretty serious illness, okay? So there's not a cure for it, but there are medications that can control that autoimmune attack. These medications can leave the individual immunocompromised, okay? So they have to be really careful about their health, and they have to be really careful to protect themselves from infection. While there is no cure for lupus, there are some caveats with those two types that are kind of out there in the nebulous territory, and that is neonatal lupus will go away when the baby is, usually around 4 months of age. It'll go away, the skin problem will clear up, but they can be left with, in some cases, permanent problems with the conduction of the heart that will require lifelong treatment. But the disease process of lupus is not ongoing for them because it was that short temporary window of time where they had mom's problematic antibodies that were wreaking havoc. Those antibodies naturally fell away. And so the disease process naturally resolves, but they can be left with permanent sequela in their heart, permanent heart problems. The heart problem doesn't happen to every baby born with neonatal lupus, but it's something that we check for and monitor for. And then also the drug-induced lupus will go away once you stop the offending medication. So in the case of minocycline, if you discontinue the minocycline, the rash, if you have drug-induced lupus with a rash, will go away, or the symptoms, if you have drug-induced lupus without a rash, will go away. So those are kind of the exceptions, but in general, no, there's no cure for lupus. Treatment is a must to control, because as you can imagine, if you do not treat and control the lupus in the skin, it goes on to scar and cause permanent disfigurement. And when it's in your scalp, it can cause permanent hair loss. How long does a lupus rash last? Well, it depends on the type of rash that you have. In the case of the butterfly rash, that, again, triggered usually by sun exposure, often lasts anywhere from a few days to weeks, and then it'll clear up. And it doesn't scar, but if you have a deeper skin tone, it can leave behind hyperpigmentation. Discoid lupus erythematosus, on the other hand, those round disc-shaped, thick, raised rashes, those will persist for months to years, and as they resolve, they do heal with a scar. If intervened on early, though, when they first pop up, and or the patient is on a medication to prevent them from popping up, then they will not pop up and go on to scar. And if they're treated when they first pop up, it decreases the likelihood of scarring. What is the cause of lupus? Well, again, it is an autoimmune disease, but your genetics play a big role. There are over 100 different genes that can be inherited that lead to someone's risk for lupus. And then there are certain triggers that are thought to turn on those genes. So not everyone who inherits those genes will go on to have lupus. That's where the science is still trying to figure things out. But there's definitely a strong genetic component to lupus. So let's talk about triggers for lupus, because this is a big one that anyone who lives with lupus needs to be aware of. There are many different triggers, and avoiding triggers is key. One major trigger is ultraviolet radiation from the sun, of course from a tanning bed, but also from fluorescent lighting, which isn't used as much as it once was, but fluorescent light bulbs can produce a small amount of ultraviolet radiation that isn't enough to impact most people, but for people with a lupus, it actually can potentially precipitate their disease. The other major trigger is cigarettes. Cigarettes are a big source of gasoline in the fire that is autoimmune inflammatory diseases in general, but especially lupus. So if you smoke, you have to quit. Not just tobacco cigarettes, but also vaping. The other big trigger that can be hard to avoid is infection. Certain medications, like I already mentioned, minocycline, can of course trigger drug-induced lupus. But if you have lupus, another thing that's really important to be very cautious with is dietary supplements, because many dietary supplements adversely affect the performance of lupus medications. So always discuss with your doctor, your rheumatologist, any dietary supplements, because they definitely can mess up your lupus treatments. Stress is another big trigger. I mean, if you are stressed to the point where it's compromising the integrity of your sleep, you're getting run down, that is definitely something that can fuel a lupus flare. Also, major illnesses, if you get in a car accident, or if you undergo surgery, that's another scenario where you have to be careful. And of course, some patients with lupus, they end up having to go into surgery because the lupus ends up damaging organs like their kidneys, for example. And so they have to go on a lot of medications to control their immune system. And these medications can have side effects that impact their appearance. And I'm bringing this to your attention because I know that one celebrity in particular, actually maybe another one recently too, I think I heard, they get a lot of criticism for the changes in their appearance. And it's like, try being on high-dose prednisone for weeks at a time, and we'll see how good you look, okay? Like, I think it's important to educate people, regardless of if you had this disease or not. My hope with this video is that now you have some understanding of what people with lupus live with and deal with, so that maybe you'll keep your mouth shut the next time some random stranger passes you by and you feel compelled to comment on their appearance, because this is an example where you never know what someone is going through, and lupus can have a huge impact on someone's appearance, whether it be the skin rashes or side effects from the medications. Who gets lupus? I already mentioned, obviously, the genetic component. So having a family member, a close family member with lupus, puts you obviously at greater risk, because it's more likely you inherited any one of those hundreds of genes. But certain subtypes of lupus are more common in some groups of people. Discoid lupus erythematosus, that's the type of lupus that can go on to scar, but it only affects the skin. That is most common in Black people. And then systemic lupus erythematosus, the systemic disease that can impact your organs, most common in Black women. It's also very common in Hispanic women and Asian women. But no matter the type of lupus, treatment is key to prevent it from going on to have more debilitating, disfiguring consequences, whether it be to your skin or to your internal organs. It is something that people who have it deal with for life, for the most part, the exceptions being neonatal and drug-induced lupus. All right, guys, that is what I wanted to say in today's video with regards to skin signs of lupus. I hope this video was educational, informative, you learned something, and that it clarified any questions you might have had about lupus. If you guys liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.